How about you, Dr. Meininger?
I will say that I've been doing this for a long time, and the standards haven't always been there. So I've been doing this since 1999. The standards of care from the World Professional Association of Transgender Health, or I think back then it was called the Harry Benjamin International Gender Dysphoria Association, basically said you couldn't see somebody until they were an adult. And there were people doing things, but it wasn't at all supported that we would be seeing children. And so for me, this first kid, my 12-year-old, I referred to an endocrinologist. The future kids, the endocrinologist didn't want to see because he didn't want to make this a part of his practice. But I was also working with homeless teens at the time, and they were doing this on their own. They were finding the protocols out there. They were buying the drugs over the internet, or my favorite was the girl that convinced 3 of her girlfriends to go in and get a pap smear because that's what you had to do to get birth control back then. And they all got birth control pills, and then she would take 3 at a time. But I saw it as harm reduction. I saw it honestly as, these kids are doing this anyways. We need to make sure they're doing it in a safe way. And if the parents are on board, so much the better. How can we provide this in a safe way? And I was the only pediatrician in the state of Minnesota for at least 10 years. I couldn't come here to Indiana until I had trained providers. So we now have 3 children's programs in Minnesota. But the standards of care have gradually come around. The Endocrine Society guidelines came out initially in 2009. So I've been doing it 10 years by then. And they said, well, you can't start somebody on hormones, gender-affirming hormones, until they're 16. And I'm like, I've broken that rule all along now. But at least, I was thrilled that now insurance companies were turning me down for guidelines, and not just because, they thought I was making this up. When the 2017 guidelines came out for the Endocrine Society, they did talk about, in certain cases, children can start on gender-affirming hormones below the age of 16. Well, as a adolescent specialist, if you haven't started puberty by the time you're 16, you're officially late. So to make a kid wait until they're 16 before they can go through puberty means that they're going to either go through their natal puberty and then have to do all the work to undo that, whether it's surgeries or practicing with your voice or whatever, or we can put them on blockers, and then they're the last kid to go through puberty, and they'll get bullied for that. So I think the endocrinologists were a little bit ahead of the game, especially those that had been doing the work. And I learned a lot from the folks that I worked with. So there are guidelines. They're gradually evolving. The problem with WPATH is it's a worldwide organization, and not every country is in the same place as the US is. I'm not going to say the US is at the forefront, but I can say that there are some Eastern European countries where it's not even legal to get hormones. And most of the people there are buying them on the streets and translating the Endocrine Society guidelines into Russian or Ukrainian. So there are guidelines. We do our best to follow them, but there are also places, I think, where we push those boundaries a little bit. And we have a lot of conversations at a professional level about what's appropriate, what's professional. And it's a lot of negotiation with parents and their children to help them reach goals that are both safe and to the best of our ability, standing up for what they need.
We've got a question that just came in through Facebook, and it was actually related to what I was just about to follow up with you, Dr. Meininger, related to puberty blockers. Susan was asking if you could share a little bit about that. I was about to ask, if the effects of puberty blockers are generally reversible and re-allowing natal puberty to take place.
So puberty blockers have been around for 25 years or so. They were initially discovered because they turn on gonadotropin releasing hormone in the pituitary, and there was a thought that these would help people who were short-statured. It didn't actually turn out that way, but we did find that we were able to turn off puberty with them and put a pause. And so they were initially used in 5, 6, and 7-year-olds who went through puberty too early. You can imagine that if you start getting your secondary sex characteristics at age 7, you're going to be ostracized from your peers. Adults will be looking at you, and or even older kids will be looking at you as much older than you are, and your height will be quite short because your growth plates will all close. So they were used for quite a while there, and somebody got the idea of, well, why aren't we using these with gender patients? And so in the prepubertal kids, we don't think there's any, after 25 years or so, we don't think there's really any long-term effects. In the kids that are right around the time of puberty, there's a lot of stuff going on. And so initially, we used the best information we had and said, we don't think there's any, it's fully reversible as far as we know. Now, the endocrinologists have done a lot of work looking at that. And the one caveat there is, like some types of birth control, there can be an effect on your long-term bone density. So if you are somebody who is a natal male about to start puberty and we put a pause, your bone density might be up here, as an adult. It would be here as a girl, and it's probably going to be somewhere in between if you've been on puberty blockers. If you're a natal female and we put you on puberty blockers, you would drop, but then we might put you on testosterone in the future. So the idea is that, yes, there is some long-term potential risk there. Everything else, as far as we're able to tell with the puberty blockers, is fully reversible, but it depends on when you start as well. If you wait until you're 13 and you've gone through puberty a couple years ago, and I put you on a puberty blocker, it's like castrating you. You go through menopause right away, you lose your sex drive, and so it's a really uncomfortable position to be in. For some people, that's worth it. If they have access to that, it's worth it. For other people, not so much. I think it's a conversation that, if the parent is really pushing something like puberty blockers, which are quite expensive, and the child is saying, no, mom, I really want to do this. I help the parents see some of the side effects that they may experience from the puberty blockers. But the biggest barrier for many kids is actually the cost. Insurance, if they even require a 20% co-insurance, that's a significant out-of-pocket cost. These cost on the order of several $1,000s a month, and that's just too much of a barrier for many people.
Yeah, understandably so.